We are very happy to have Nicole Boyd with us. Nicole is a pharmacy practice assistant, also with the IWK Health Center. Great representation at the IWK today, so shouts out to the IWK staff for all that they're giving to junior achievement. How are you doing, Nicole?
I'm doing great today. How are you?
We are fantastic. We're so happy to have you with us. Can you explain what is a pharmacy practice assistant? Yeah.
So a pharmacy practice assistant is what we call ourselves here at the hospital, which is also known as a pharmacy technician, which you may have heard of in a community setting. So we do things on the more technical end. So I'm assuming you've heard from a pharmacist already today.
Yes, we have.
And so we do more of the technical aspect of things. So during my day in the hospital setting, I can't fully speak to the community setting, which would be like your Shoppers or your Lawtons. But for me, I do 50-50. So I do 50% in the dispensary and I do 50% clinical work. So as a new grad coming out, you would be trained in the hospital in certain areas, such as dispensary, which would be any stat medications going up to your floor. You'd be trained in the sterile room, which is any IV medication preparation, which we also have SIVA, which is the same type of thing, but those are for our larger kids, so the quantities of the IV medications are larger. We do chemotherapy preparation. We do unit dose, which is a 24-hour cassette of medications that each patient is getting on each unit, and we deliver those to the unit so that the nurse has access to 24 hours worth of medication, and then we do that all again the next day. Yeah. We also do packaging. So each med is packaged into an individual package with a lot and expiry so that if any meds are recalled, we can know where all of that med is located and retrieve that so that it doesn't get administered to any patients. We also do purchasing. So that's buying any medications from your regular medications like Tylenol or Advil to chemotherapy medications. We receive all of those meds. My other portion of my job is clinical. So I work on the oncology unit, and that includes a different array of skill sets. So I do medication histories. So I go and I meet with a patient and their parents, and I do a list of all of the medications that they are on, and I match that to our system called DIS. So that's the Drug Information System for Nova Scotia. And I match that to make sure that what the pharmacies have prescribed is what the parent is giving to that child. So I do that. I do, when a patient is discharged, I do medication calendars. So that becomes a health record, and that goes home with the patient, and the parents can check off each med that they have administered every day. So that can range from a 1-week calendar to a 3-month calendar, depending on where that patient is in treatment. So if a med is given 3 times a day, I have 3 boxes that for each day that the parent can tick off. I also do procurement for any kind of weird and wonderful meds that we get on the chemotherapy side of things. They're not our typical meds. Each child is essentially different. So there's different protocols for different types of disease. So we have to get in different medications. Sometimes they're not always the same. And I make sure that all of those medications, as best as I can be covered for that family. So if there are medications that they're getting at home, I try to make sure that they are covered through their insurance plan. And if not, I try and reach out to see if there's any compassionate programs available.
Okay, thank you for that.
You're welcome.
That's great information. Did you always think that you wanted to be a pharmacy practice assistant, or how did you get here?
So I kind of always knew that I wanted to be in healthcare. I knew I did not want to be a nurse because I don't deal with blood, that kind of thing. So it's a more behind the scenes, but I still get patient interaction, which is lovely. So I also did a Bachelor of Science at Dal and in chemistry. And I didn't know what I wanted to do at the end of my degree. And I had leaned towards pharmacy, but that would be another 4 to 5 years of school. So I opted to go to NSCC to take their pharmacy technician program. And at the time, it was a 1 year program. And then I was able to enter into the workforce after that. Now it's a 2 year program, which is still not unreasonable coming out of school. You can enter that program straight from high school. You just need a couple your science credits and your math credits in order to enter into that program straight from high school.
Super. No, that's great. When you did your the program at NSCC, how did you find that program? Can you speak a little bit about what you studied and how difficult it was?
I felt like I had a bit of an advantage having a chemistry background for any of the pharmaceutical related things. I found the workload was standard. Like, you still had your homework, I still had to study. I found comparing a bachelor's degree, which I know you can do co-op. I opted not to at Dell, but I found the work placements that I was able to do through NSCC really set me up for getting a job in my field. So I was fortunate enough to do my work placement through NSCC at the IWK, and I was hired on after I was a student there.
Okay, thank you. You talked a little bit about a typical workday, but can you talk a little bit about in terms of the patient interaction that you spoke to?
Yeah. So I see patients only when I'm on my clinical duties. So I would see patients to go over their med histories, and then from that I would make up a med calendar where I would hand that off to the pharmacist, and the pharmacist would do any counseling on any drug changes that they had since their previous calendar. So I see patients to discuss what they're currently on, and I see patients to discuss their insurance info and if they have any questions or if they need any forms filled out.
Okay. And what do you like most about your job?
I do love the patient interaction, and where I work on oncology, there's a lot of the same patients. They're frequent flyers, we call them. So they're in and out of the hospital. So you get a rapport with those patients. And my favorite part of my job is when they finish treatment, we have a thing where they ring the bell. So they're all young kids because I work at the children's hospital. And when they finish treatment, it's just so amazing to see them ring that bell, and just such a sense of accomplishment where they finish and they're just so happy and relieved to be done.
I can imagine. Oh my goodness. For the students, can you explain, they may not know what oncology means?
Oh, oncology is anything related with chemotherapy. So if you have cancer and you need to come to the hospital to get chemotherapy, that's the unit that I work on.
Thank you. So can you also speak about your schedule? Do you work Monday to Friday, and talk about your work-life balance?
Okay, perfect. So at the IWK here, we don't have casual technicians. I know at Nova Scotia Health Authority, they have casuals that they can call in on a day-to-day basis. For us here, we work Monday to Friday, 8 to 4. We work about 10 to 12 weekends a year. We pick those a year in advance. We know when we're working our weekends, and then we work night shifts occasionally, and those are 1 to 9. So we never work overnight. Mm-hmm. I feel with my job, I don't take my work home. When I'm done at 4, I'm done for the day. And I feel like I have a very good work-life balance where I can go home and spend time with my family. And then I come into work and I do my work.
That's great. Wonderful. Can you give us an idea of a starting salary?
Starting salary is around probably 40,000, and then you have your pay increments you increase over 5 years, and then you're capped. And then we are part of the union, so that your wages get negotiated through your union contract. So we're a part of a union. We can't really negotiate for our own salaries. We all have the same salary.
Wonderful. And because it's so detrimental to what you do in working in a hospital, how has COVID affected what you do?
So I know in the presentation that I did. I have felt very fortunate that as a healthcare worker, I've had job security the whole time. Healthcare is always going to be needed, and so I've felt very secure. We did, in the beginning stages of the pandemic, switch into a different schedule where we were separated into two teams to kind of minimize exposure. So we worked longer hours. We worked 12-hour days, but we had more days at home. We have since gone back to our regular schedule, and there's no talk of going back to that old 12-hour shift days. We do wear masks unless we're at our desk, and to see patients, we wear face shields.
Okay, thank you. Nicole, I'm going to give the students a moment to put some questions together, which will be relayed through their teachers, and it will take a second. In the meantime, Can you talk about the demand in the career field in Nova Scotia?
Okay, and I have one more other thing I want
Perfect,
to add as well. So the demand is always kind of here. We're always, healthcare is always essential. There's definitely demand. There's always community pharmacies, and I feel like those jobs are able to snatch up. You're able to obtain those easier. It is harder to get on in the hospital, but I would never say to give up on those. We do have different clinical settings that are always coming up. We don't have technicians on all of our floors here at the IWK, so those are always kind of arising, and I don't know where I was going with that. But yes, there's always demand. For pharmacy practice assistants. The other thing that I did want to touch base on is there is a licensing exam after graduation. It is not currently recognized in Nova Scotia. However, the rest of Canada is moving, like they recognize it. So we're just kind of waiting for Nova Scotia to recognize that. It is a 2-part exam. It's a multiple choice part, and then there's a practical part of that exam where you would go in and you would do a scenario based with actors, and you would have someone assessing you, and you would have to act as if you were a pharmacy technician.
Okay.
We do see a few questions come in there.
Yeah, we do have a couple of questions. So how long have you been working in this field?
I have been currently at the IWK for, I think, 7 years, and I've been 4 years on the oncology department.
Okay, thank you. And the other question is, how does it affect your mental health seeing lots of sick people? That's a great question.
That is a great question. As I mentioned before, the bell is definitely a big part. So that's really rewarding. Mind you, where I work with cancer patients, it is tolling, and we do have some very, very hard days. We have a great team here in our pharmacy and with the nurses and doctors on the floor that we really lift each other up and we support each other. So that support is definitely key. But it just try and look for the positives instead of just looking at all the negatives and all the sick kids. You try and look for those positives and the rewarding parts of your day.
Mm-hmm. No, that's a great point. Does anyone have any other questions? And that has been sort of a theme with the people we've talked to today with the IWK, is the sense of team there. So whatever IWK is doing, they're doing a great job with supporting their employees for sure.
Yes.
We'll just give it 1 second. And you said you had one other thing you wanted to share.
Yeah, it was just about that exam. I just wanted people to know that there is a licensing exam, and where it's not required here, it is an asset for if you're applying for jobs. I know that at the IWK, they put it as they do like to see that you have your license, even though it's not required and not recognized here. I do hold my license, and you can write the exam here. I do run that exam in Halifax. So it is offered in Halifax as a site. It's offered once a year.
And you run that exam?
I do.
Okay.
Yeah.
Interesting. So I think there's all kinds of things that, in terms of opportunity, even with a pharmacy technician or whatever you want to call it, that there's a variety of options that you can choose within that or grow into.
Yes, definitely. So I also used to hold a position as our Pyxis support person. So a Pyxis med station is a station that goes on each unit. It's more of a technical thing. So it houses all of your commonly used meds on for that unit. So I used to do support for that, and then I since changed to do a clinical role where I have more patient interaction. So if you don't want the patient interaction, you don't necessarily have to have it in the hospital.
Okay, great. And no more questions coming through yet. I'm going to leave you to give a piece of advice. So we're talking to 14, 16-year-old students. What advice would you give them?
Just to not give up. I didn't. I was fortunate to get my job at the hospital right away, but there was a period of time where I had graduated and I hadn't heard back. So if you don't get that job that you want right away, just keep applying for it and take other jobs and have your abilities to grow and grow your knowledge base, because everything that you bring into an interview is experience, and you can use that as points to talk on in your interview. So just don't give up on yourself.
That's fantastic advice. Thank you so much, Nicole, for joining us this morning. It has been very valuable for the students, and I'm sure that you've consider when they think forward to their career options.
Thank you for having me.